Hey family, it's Dr. Yola coming to you to discuss the pediatric COVID-19 vaccine for our 6-month to 4-year-olds. We are in yet another surge with BA.5, BA.2.75, where we're seeing again cases increase, hospitalizations increase, and even deaths slightly increase with these new subvariants. So let's talk through how do you make that decision. The first thing I want to do is talk through the data. What did the clinical trials look like? And then what are the factors that parents should consider in deciding whether or not their children should be vaccinated? So let's talk through the data. So when Moderna and Pfizer presented data for the FDA to approve the emergency use authorization, it was based on, for Moderna, looking at over 6,000 children in their clinical trial, and for Pfizer, over 4,000 children in their clinical trial. In terms of an age breakdown, a little over 4,000 children between the ages of 2 to 5 were in the Moderna study, and then around 2,500 children between the ages of 6 months to 23 months were in the Moderna study. For Pfizer, with over 4,000 children, around 2,700 of them were between the age of 2 to 4, and then around 1,700 of them were between the ages of 6 months to 23 months. In terms of dosages, with the Moderna vaccine, it's a 2-dose series. With Pfizer, it's a 3-dose series. The difference in dosing is one, because with Pfizer, when they attempted a 2-dose administration of their vaccine, particularly among the 2 to 4-year-olds, it did not trigger a strong immune response, and so they ended up having to add a 3rd dose. The second reason is that Moderna and Pfizer have taken similar but different approaches in terms of the creation of their vaccine, specifically for the pediatric population. Moderna has gone with what is the strongest dose we can give with the minimal amount of side effects so that we have a long, strong immune response. Pfizer has given the lowest amount of vaccine that triggers a strong enough immune response in order for us to be protected. In terms of follow-up, Moderna followed study participants about 2 months after their 2nd dose. Pfizer followed participants about a month and a half after their 3rd dose in order to determine whether or not there were any significant side effects or adverse outcomes. And again, we'll talk through side effects are the minimal sort of reactions that people have whenever they get a vaccine. It's sort of a side effect like when you take diphenhydramine, also known as Benadryl, you expect to get a little bit sleepy, right? With receiving vaccines, it's expected that you might get a little bit of fever, soreness at the injection site, a little bit of redness at the injection site. All of those are side effects that were observed in the pediatric population. There were no adverse outcomes in the study groups associated with the vaccine. And the good news is now, over 4% of children 0 to 4 have now received these pediatric vaccines, over 700,000 children, and we have not seen any reporting of adverse outcomes, those significant health events like myocarditis, blood clots, Guillain-Barré, etc. We have not seen significant reporting of any of these adverse outcomes in this youngest age group. And I'm keeping a close eye on the vaccine adverse event reporting system that healthcare providers use. Clearly in the lay media and in social media, we would have heard some significant buzz if there had been impressive side effects and adverse outcomes in this particular age group, in the same way that we heard a lot about myocarditis in the adolescent population, particularly among white adolescent males. We saw that there was a slight increased risk of myocarditis in the vaccinated population compared to the general population, but significantly less risk of myocarditis in the vaccinated population compared to those who had COVID. But in this youngest population, myocarditis is rare at baseline. We do not expect, as a general rule, for children between the ages of 6 months to 4 or 5 years of age to have high risk for myocarditis. With viral infections and with other viral-based vaccines, we have seen very, very, very low numbers of myocarditis, if at all. So the good news is that we're not seeing reporting of significant adverse events with this vaccine among our youngest population. So, Dr. Yola, if we're dealing with a gentler, milder version of COVID-19 compared to the original COVID-19 virus, the beta variant, the Delta variant, why should parents consider getting their children vaccinated with Omicron when it seems to be causing less severe symptoms. What I would say to you is that, particularly with the Omicron variant, it has disproportionately impacted children compared to the other previous variants. So we know that all of the former variants before Omicron caused more infection within the lungs. As my grandmother would say, it infected and affected you from the rooted to the tutor, from the crown of your head to the soles of your feet, right? Well, then showed up Omicron sometime in January, where Omicron had a preference for the upper airway, what we call the bronchi and the bronchioles. And children's air tubes, those bronchi and bronchioles, are much smaller. They're much tinier than in adults. So anytime infection or inflammation gets in their air tubes, it's going to cause more severe symptoms. And that's what the data shows. When we look at what happened with Omicron back in January, what we saw is that among the 0 to 4-year-old age group, more children were hospitalized in the 0 to 4-year-old age group than any other age group within the pediatric population. When we look at life lost, over 400 children in the 0 to 4-year-old age group have died due to COVID-19. And when we compare COVID to any other vaccine-preventable disease, COVID-19 has caused the highest number of deaths in this age group. The highest number of deaths in this age group when compared to any other vaccine-preventable disease. And among those children, those 0 to 4-year-old children who were disproportionately hospitalized due to COVID, in comparison to any other pediatric age group, 1 in 4 of those children ended up in the ICU. So for anyone who says, oh, COVID doesn't infect or affect little ones, that's simply not true. The data shows differently. So that's the first consideration as to why parents should think through getting their children in the 6-month to 4-year-old age group vaccinated against COVID-19, and even the 5 to 11-year-old age group for that matter, right? Higher risk of hospitalization in this age group, higher risk of ICU admission, and then COVID being the highest cause of death compared to any other preventable or vaccine-preventable disease. The second reason why we want to consider our third, because it's the hospitalizations, right, and ICU admissions, the risk of little ones dying from COVID, and the third is layered approaches. We know that getting our little ones to wear a mask is a struggle. Like, one, just to get them to do anything really at the age of 2, like they call it the terrible twos for a reason. Getting them to wear a mask from a developmental standpoint can be difficult. They're in camp, daycare, preschool. They've got to take their masks off to have snack and to eat. We want to make sure that we provide a layered protection. All right. If they can't wear their mask, we may have some challenges social distancing. The vaccine is just yet another layer of protection for them, especially as we get ready to navigate back into the fall, given that there is some likely seasonality to COVID in the same way there's seasonality associated with influenza. The fourth reason why you want to consider getting your child vaccinated against COVID is the collateral impact. When a little one has COVID, they end up out of school. They end up facilitating you having to stay at home to take care of them. And certainly I wouldn't tell a parent to get their child vaccinated simply to save costs and not to have to use your sick days. But as a mother myself, as an entrepreneur, I know the impact that it had. And my daughter was vaccinated. Thankfully, because she was vaccinated, how long she was symptomatic and positive was shorter than what it could have been. But to be able to protect our little ones from not missing out on any more school and from families not missing out on any more work, it's definitely something to consider. And then long COVID, a conversation we certainly do not have enough of in terms of our youngest population, but young children are at risk for COVID. Recent studies have shown that of all children who have developed long COVID, close to 40% of them have been between the ages of 0 to 4. With them showing symptoms like mood swings. You thought those were terrible twos. Perhaps that's long COVID. Stomach aches and other digestive issues, and then rashes. Those are the most common symptoms in the 0 to 4-year-old age group. From 4 to 11, not only are they experiencing mood swings, they're also having difficulty concentrating and focusing. So you're talking children in pre-K, kindergarten, and older. And it may not be that they're just having difficulty in school. It may, again, be a sign of long COVID. And what we know from the data is, 1, children who are unvaccinated are at higher risk of long COVID. We don't know the percentages for children, but we do know them for adults. An unvaccinated adult has a risk of long COVID somewhere between 10 to 30%. For those of us who are vaccinated, the risk is somewhere between 0.5 and 5%. In addition, the more frequently we have a COVID-19 infection, data recently shows that the more times you have COVID, the higher your risk is of long COVID. So imagine the impact that long COVID may have on our little ones, not to mention some of the other complications resulting from COVID-19, like the multisystem inflammatory syndrome that shows up a couple of weeks later. As parents, we really want to make the most informed decision we can in terms of how we navigate our children through pandemics. I hope that the information that I have shared has helped you in making a decision. Certainly, I will keep you updated if there are any concerns or questions around the vaccine. When I considered getting my 9-year-old vaccinated against COVID, I took all of these pieces of information into consideration. What has the experience been of children who've already been vaccinated? What are the numbers of children who've been vaccinated? What are the side effects, the adverse outcomes? What are the numbers on the COVID side looking like in terms of risk of hospitalization and even death? All of those came into play when I made a decision about my daughter getting vaccinated. And the same thing for myself. I expect nothing less of any parent making an informed decision for their children. I hope this information has helped you. I look forward to respectful conversation around it. I know sometimes it can get real dicey when people start talking about pediatric vaccines, inclusive of children's standard vaccines. We just saw a case in New York of someone coming down with polio. We haven't had a case of polio in over 10 years in this country. It was in an unvaccinated young adult. We will certainly see more of that as more children are not getting their routine vaccinations. And that's certainly another conversation for us to talk through. But I at least wanted to share information about the latest addition to the pediatric COVID-19 options, all right? Take care of yourselves, take care of each other, take care of your babies. Don't hesitate to reach out and let me know how I can be of assistance. Take care. Dr. Yola out.